surgical procedure has a risk, and the risk is that there could be extensive bleeding as a result of manipulating the ovaries, because ultimately what we're doing in an egg retrieval is we're passing a very thin needle into all those follicles that are present in the ovary. Now, blood vessels actually cover the ovary entirely in many places. So it's very difficult to see very, very tiny blood vessels. Again, in 99% of the cases, there is no complications because the ultrasound nowadays gives us very extensive imaging to where most of these blood vessels are running. So we would avoid them when puncturing these follicles so that we don't hit a blood vessel or an artery, which leads to a higher level of bleeding. Most tiny amounts of bleeding are immediately dealt with, and the bleeding stops within no time. But as I said, in 1 or 2% of the cases, bleeding can happen from a larger vessel. There is a risk of infection as well because it's a needling process. So essentially, there's a very, very small risk that the bowel could be scraped as a result of the egg collection, and there could be peritoneal or intra-abdomen infection as well. We do give antibiotics as a prophylactic procedure, which can prevent infection. So the patient is given some strong dose of antibiotics after the egg collection so that any kind of risk of infection is absolutely minimized. But there is always a risk, however small that risk is. But by and large, the procedure is very straightforward. Patients walk out of the clinic on their own, even though they've had sedation and anesthetic, and they're absolutely fine to go home within an hour and a half of egg collection.